All right. Okay, so here we go. Welcome, everybody. My name is Evan Adler, and I am a physical therapist at UNC Therapy Services. And this is Therapy Thursday. This is our chance as part of the UNC Therapy Services and Community Engagement Committee, our way of kind of getting in touch with everybody out there, especially in these tough times of COVID, where we typically do things where we're very hands-on with our patients and the community, and this is just our way of kind of adjusting to the times. So for those of you who haven't attended these before, on the first and third Thursdays of the month, we have an informational presentation here on this lovely WebEx, where we get to talk about topics that have been brought to us by the community or things that we find interesting that kind of grab our attention. So you can find our events on our Facebook page, and our recorded presentations are on our YouTube channel. Both links I will go ahead and put in the chat later during the presentation. But for today, we have a very interesting topic. As a runner and someone who runs with a lot of women, and as someone who has a wife who has had 2 kids, I am familiar with some of this topic myself. So what I'm going to do is pass it on over to Sarah, who has a wonderful amount of information to give to us today. One thing I will say is that as we're going through the presentation here today, if you do have questions, we are going to ask that everybody save their questions until the end, and we'll leave some time there where Sarah can answer those. And we'll also give you some contact information if you'd like to contact us more privately. So without further ado, I'd like to introduce Sarah Roney.
Hi, everyone. Thanks so much for joining. I'm looking forward to a good presentation and a lot of great questions at the end. But, as Evan said, if you don't feel entirely comfortable speaking up here, I have my email address included at the end of the presentation, so you can reach out to me directly. I've been a pelvic PT at UNC for about 2 years, and I've been out of PT school for over 10. Been dabbling in the pelvic world for about 5 of those 10 years, and worked in a variety of settings. So hopefully I have a good amount of information to share with you that you'll find useful. So we'll take it away. Looking for ways to manage your incontinence, Urine Luck. So I hope everyone appreciated my title. Just have to put a little bit of humor into it to make things a little bit more interesting. Okay, first off, what is incontinence? So a lot of patients, when they come in to see me, I'll ask them, do you have incontinence? And oftentimes people will say no. Then further into our conversation, they may divulge that, well, I do leak a couple drops when I cough, or I do have a little spot in my underwear when I'm rushing to the bathroom. And that technically is incontinence. So the true definition is loss of bladder control, ranging from just a few drops to a complete emptying of your bladder contents. So essentially, anytime you leak urine outside of sitting on the toilet and going to the bathroom, that is considered incontinence. And incontinence can occur with certain activities, for example, strong urges, or really for no apparent reason at all. There are multiple types of incontinence, and I thought it would be helpful to maybe go through and discuss the most common ones that I see in practice. I would say the one that I see most often is called stress incontinence, or SUI, and that occurs when pressure in the abdominal wall increases. So for example, with coughing, sneezing, laughing, lifting something, doing something strenuous, and that can cause you to leak urine. The next type of incontinence is urge incontinence, UUI, and as the name implies, it's leaking urine when you have this immediate, almost sudden, unstoppable urge to go to the bathroom. So typically leaking on the way to the restroom. And this often occurs hand in hand with overactive bladder syndrome, or OAB. Mixed incontinence is a combination of the two. So a combination of the stress and urge incontinence. Overflow incontinence is something that occurs when maybe there's damage to the pelvic nerves or altered sensation, and a person is unable to feel their bladder filling up with urine. When that happens, the bladder can get overly full and urine can start leaking out. And oftentimes, this is in the absence of any urgency. And finally, functional incontinence. And this is more so a problem with either mobility or cognition, where someone has difficulty getting to the toilet, and that is what makes them leak urine. So oftentimes there aren't any issues with the urinary system itself, but there are more external factors coming into play. Here's just some key statistics that I thought were kind of interesting, and basically they outline just how common this problem is. So even though you may feel like you're alone, tons of people are experiencing some sort of incontinence in their daily life, and it's just that people don't really talk about this, so we don't realize how big of a problem that it is. But these statistics definitely outline that. So 17% of women over 18 years old have overactive bladder syndrome, and an estimated 12.2 million adults, so men and women, have urge incontinence. OAB and incontinence occur about twice as frequently in women and become more prevalent with age. So just being a woman, unfortunately, puts you at an increased risk for having urinary leakage. And as you get older, you're also at a greater risk. 29% of individuals ages 60 to 70 experience leakage with coughing, sneezing, or laughing. And that's that stress incontinence we discussed earlier, compared to 17% of men and women ages 30 to 39. And this last stat is pretty eye-opening. 1 out of 3 women over the age of 45 and 1 out of 2 women over the age of 65 have stress incontinence. So again, a very, very prevalent problem, and people just don't talk about this. So it is very, very common in our society. That being said, why does incontinence occur so often? Well, there are a couple different reasons why, typically depending on the type of incontinence you have. So the first type that we discuss, stress incontinence, is usually the result of weak pelvic floor muscles. Why would your pelvic floor muscles be weak? Well, maybe you just had a baby. Maybe you have a respiratory condition that puts you at risk for excessive coughing. Maybe you had surgery on your prostate or surgery on your female organs. Or maybe you are just a little bit older. All of those things can contribute to pelvic floor muscle weakness. When those muscles are weak, they have an inability to withstand all that pressure building up in our belly or in our abdominal cavity. And that can occur with coughing, sneezing, laughing, lifting, those activities that were discussed in the previous slide. So when the pelvic floor can't withstand that buildup of pressure, the urethra opens up a little bit and urine leaks out or just completely flows out. Urge incontinence, on the other hand, is typically the result of a very overactive bladder muscle. When the bladder muscle contracts or spasms, it gives us a really strong sense of urgency and can also cause us to start urinating. And so if we're not ready for it, it comes on very suddenly, that can result in incontinence. Overflow incontinence occurs with incomplete emptying of the bladder. So as I mentioned previously, that could be an issue with the pelvic nerve, so a nervous system problem, but could also be due to tight pelvic floor muscles. When our pelvic floor muscles are unable to relax fully, they apply a bit of pressure on the urethra, pinching it closed. And so when that happens, it's difficult for us to empty all the contents of our bladder. And finally, functional incontinence is a cognitive or motor impairment. So these types of patients may not have any issues with their urinary system, but potentially they're really weak. They have poor balance. It takes them a long time to get to the bathroom. Maybe they're experiencing dementia, memory loss. All of those things can impede someone's ability to access the toilet. And in the meantime, they can leak some urine. Okay, I've been talking a lot about the pelvic floor, and I think it would be helpful to maybe take a look at what the pelvic floor visually looks like, and then talk a little bit about what it does, what its main functions are. So in the picture on the left-hand side, you can see female and male anatomy, and the pelvic floor is that kind of burnt orange or reddish structure that forms kind of a hammock or a sling that sits beneath our organs. So that lateral view is really nice so that you can kind of appreciate where the pelvic floor is located in proximity to the internal organs, and also understand that one of its functions is to support and hold those organs up and in. Okay. And then looking at the picture on the right-hand side, again, we see male and female anatomy. And anything that's colored is a pelvic floor muscle. So you can see how those muscles are very closely related to the genitalia. They also wrap around all of our openings, the vagina, the urethra, the anus. And in that sense, these muscles are really involved with bowel and bladder control and sexual function. When the pelvic floor muscles tighten, they close off all of the openings seen in that picture, thereby reducing the likelihood of leaking urine or leaking stool or even leaking gas. Some people have trouble with gas control due to weak pelvic floor muscles. On the flip side, though, when you go into the bathroom to urinate or have a bowel movement, those muscles need to completely release, let go, stretch, in order to allow the urethra to open, the anus to open, and urine and fecal matter to pass out completely. And finally, again, they play a role in sexual function. So these muscles are very closely situated to all the genitalia, including the penis and the clitoris. And when these muscles rhythmically contract a little bit, they bring blood flow to the area, aiding in arousal and eventually climax or orgasm. So that's just a little brief overview of the pelvic floor and what it does. And hopefully those pictures are helpful for visualizing exactly where it's located and what it does. Okay, so now we are going to move on to ways to manage incontinence, the real reason that you're all here, right? And these are the key topics that we're going to talk about in the next few slides. Number 1, pelvic floor muscle strengthening. 2, core strengthening. 3, breath management. 4, good bladder habits. And 5, avoiding constipation. Okay, so what is a Kegel? I have had so many people come in and have just really interesting ideas of what a Kegel is, or how to do a Kegel correctly. A lot of different pronunciations of the word as well. So just to set the record straight, I thought we could talk a little bit about Kegels, so everyone's really clear on what this actually is. You know, the elusive Kegel, right? So a Kegel is a contraction of the pelvic floor. It's when you tighten those muscles down there. And you can feel a couple things. You may feel the vagina or the anus actually tightening up. You might just feel kind of an overall sense of pressure in the genital region, or you may feel a drawing up sensation, and that can be felt, either internally inside the vagina or anus, or at the base of the penis, as if the penis is retracting a little bit. So those are some different types of sensations that, a patient or a person may feel when they're doing these exercises, and to kind of ensure that they're doing them correctly. What do pelvic floor muscle exercises or Kegels help with? Well, a wide array of things on this list: improving bowel and bladder control, reducing the risk of prolapse. And prolapse is basically a sagging of the internal organs. So if the pelvic floor muscles are strong, again, they hold those organs up and in. Pelvic floor muscle exercises or Kegels also help with recovery from childbirth and surgery, including prostate surgery. They help with sexual sensation and function. And also, they just help increase your quality of life. If you don't have pain in your genital region, if you're not leaking urine or stool, if you're able to enjoy good sex, then obviously your quality of life is going to be a whole lot better. Okay, before you all run home and just start doing Kegels all the time, there's one caveat to this exercise. I think people tend to perform Kegels and practice tightening their pelvic floor no matter what their issue is down there, and you really can overdo it with Kegels. And sometimes Kegels aren't even the right exercise prescription for somebody based off of what their symptoms are. So I like to throw this in here so people are aware. Pelvic floor muscles are not always just weak. Like any other muscles in the body, they can be really tense or tight too. And if that's the case, if you actually have a tight or a tense pelvic floor, you are not going to have a good response to Kegels. If you think about it, tightening a really tense muscle in the long run is just going to cause a lot of fatigue. It may actually tense up the muscle even further, or it can weaken the muscles. So there are pretty much three negative scenarios to this situation. So again, if your pelvic floor muscles are really tight, Kegels really aren't the answer. Tightening a tight muscle will have a negative impact on your symptoms, and you may actually make your urinary incontinence worse. A lot of people are probably wondering, how will I know, or how am I aware of, my muscles being tight or tense? It's difficult to perceive that yourself. You probably would need to consult with your doctor or a pelvic floor therapist to really understand if your muscles are tense or weak or both. But a couple things to look out for: if you're somebody that has a lot of pelvic pain, if you're somebody that has difficulty emptying your bowels or your bladder, if you're somebody that has pain with intercourse, all of those symptoms could indicate that you actually have tension in your pelvic floor. So I think the best course of action, if you're unsure, is to consult with your doctor, maybe get in to see a pelvic floor therapist. They will do an exam to determine what the true state of your pelvic floor is and ensure you're doing the right exercise. That was a brief overview of pelvic floor muscle strengthening. The next thing that I wanted to discuss was core strengthening. And by core strengthening, I don't mean a lot of sit-ups or crunches. That can actually increase a lot of pressure in the abdominal cavity and possibly cause urinary leakage. Rather, I think it's a good idea to strengthen the transverse abdominis, or the lower core muscles. And you can see in this picture at the bottom of the slide, the transverse abdominis muscle highlighted. So it's a broad muscle in your lower belly, and it wraps around your core. It provides a lot of protection and stability. You can kind of think of it as your internal corset muscle. So when you activate the TA correctly, it does kind of cinch everything in or pull everything in. Now, why would working on this muscle help with urinary leakage? As you remember, hopefully, from the previous slides, the main cause or rationale for stress incontinence is sudden transmission of increased intra-abdominal pressure, and then that pressure pushing down through the pelvic floor. So with coughing, sneezing, laughing, lifting, there's an increase in intra-abdominal pressure, and oftentimes that intra-abdominal pressure pushes down through our pelvis. And if our muscles are too weak, we leak urine. So the solution is to work on activating your transverse abdominis muscle. And when you do that, you do increase intra-abdominal pressure, but you confine all of that pressure just to the abdomen, and you reduce pressure being placed on the pelvic floor. Another interesting thing is that when you contract your transverse abdominis or your TA muscle, you also have a slight co-contraction of your pelvic floor muscles. So you're essentially doing a Kegel without even knowing it. And again, that can help in the prevention of urinary leakage. So I'm sure a lot of people are wondering, how in the heck do I activate my TA? So an easy way to do that is to find your hip bones in your abdomen and kind of walk your fingertips in. Okay. And so you'll be pressing in on your lower belly, below your navel, and inside your hip bones. Okay. And then you would take a deep breath in. When you exhale, you try to pull your belly button in, just like somebody has a string around your navel and they're trying to pull your navel back towards your spine. Another thing you can think of too is tucking your tummy in or pulling it in like you're trying on a tight pair of pants. And when you do that, you should feel a little bit of tensioning in your lower abdomen right by where your fingertips are. So that is a way to activate or engage your transverse abdominis. I mentioned taking a deep breath just a minute ago. And breath management, our third topic, or our third management strategy for incontinence, is really, really important. A lot of people tend to, sorry about that. A lot of people tend to breathe with their upper chest, and it kind of looks like this. And their chest rises with an inhale and falls with an exhale. Really, we should be focusing on breathing deep down into our belly or our abdomen, because by doing that, it allows us to tap into our deep core muscles and coordinate all those muscles so that we can better improve bladder control. The pictures that I've included in this slide, I think, are really helpful to kind of outline the correct way to breathe diaphragmatically or breathe through your belly. You can see in the picture on the left, the woman has her hands underneath her rib cage, kind of in the center of her abdomen. And as she's inhaling, she's thinking about her hands not only moving out in front of her, but her hands also moving out to the side. So you can think of your abdomen filling up with air like a balloon, and also expanding to the side, kind of like an accordion opening up or an umbrella opening. So maybe everyone give that a try. Put your hands on your abdomen underneath your rib cage. And when you take a nice deep breath in, you should feel your hands move kind of forward and to the side. When you exhale, as you can see in the picture on the right, the opposite should happen. So everything should move in. So your hands are moving in towards your belly and cinching in on the side, almost like you're being cinched up with a tight corset around your abdomen. And that is when the transverse abdominis, the muscles that we discussed in the previous slide, that's when those pull in and when your pelvic floor activates. Okay. So during inhalation, when everything is kind of pushing outward and to the side and abdomen's filling up with air, your deep pelvic muscles and your pelvic floor muscles, so deep core and pelvic floor, those muscles are kind of relaxing and they're stretching a little bit. They're not doing much. But during exhalation, when that internal corset effect is happening, that's when your deep core or transverse abdominis muscles and your pelvic floor muscles are engaging and are active. So this is kind of a new way of thinking when it comes to breathing, because most people probably breathe completely the opposite. But again, this is a great exercise to practice to try to involve your diaphragm in breathing and to also tap into your deep core and pelvic floor. So because the deep core and the pelvic floor are active during exhalation, it can be really helpful to exhale when you're exercising or lifting something heavy. If you breathe out, let your air out, you're reducing intra-abdominal pressure and you're engaging your TA and your pelvic floor, which can be really helpful when you're doing an exercise or lifting a heavy object, both of which could predispose you to leaking. So I think the main takeaway from this slide is to remember to breathe out when you're doing something strenuous. Okay, our next topic is bladder health. So these are just some general guidelines that I think would be important to consider, and maybe take a minute to think about what your typical day looks like and if any of these things apply to you, because they're pretty easy fixes and can make a huge impact on your urinary leakage. So one thing to consider, normal urinary frequency is every 3 to 4 hours during the day and up to 1 time per night. If you're going much more often than this, you may want to consider urge suppression, meaning trying to push off going to the bathroom by even just a short period of time. And that way you can slowly increase your urinary interval. If you're going much less often than this, maybe you get to the end of your day and you realize, oh my gosh, I've only gone to the bathroom 3 times. You may want to consider setting a timer on your phone so that you're going to the bathroom every 2 to 3 hours, or at least every 3 to 4 hours, so you're within normal limits with urinary frequency. So what that shakes out to is about 5 to 8 times per day. That's considered normal, and again, 0 to 1 time per night. Water consumption. This is really, really important. I think most folks, if they're experiencing urinary leakage, would probably restrict how much fluid they're drinking. Makes sense. If I'm leaking urine, then I'll just stop drinking water or stop drinking fluids. There'll be less in my bladder and I'll leak less often. Well, actually, restricting your fluids can have an opposite effect on your bladder. If you're not drinking very much, your urine is super concentrated, so it's that like dark amber color, and your bladder does not like that. That's very irritating to the bladder lining. So really highly concentrated urine can make your bladder irritable, can increase urgency, increase the need to go to the bathroom, and also predispose you to leaking. So it's really important to stay hydrated, keep your urine more diluted, and consume about 48 to 64 ounces of water per day. But the one caveat to that is try to limit how much fluid you have in the 2 hours before bedtime. It can also be helpful to avoid bladder irritants, which include some of the following foods and drinks I've listed here. There are other things that are considered irritating to the bladder, but these are the main offenders. Some healthy voiding habits. When you're sitting on the toilet, try not to do your Kegels then. A lot of people are tempted to see if they can, quote unquote, stop the flow of urine. And it's a good thing to do every once in a blue moon just to see if you're activating your muscles the right way and doing your exercises correctly. But if you do that too consistently, that's going to kind of play tricks on your brain. And eventually, your muscles are probably going to start tightening up when you're trying to pee. You don't want that to happen. Another thing to consider too is, are you straining or pushing to try to get those last few drops of urine out of your bladder? You don't want to do that either, because that can put a lot of stress and strain on the pelvic floor. Really what you should do is just try to relax. Maybe sit there and do some deep breathing, take your time and just try to fully relax those pelvic floor muscles so the urethra can open up and urine can flow out. Finally, try not to hover or squat over the toilet. Your pelvic floor muscles stay pretty tight and tense in that squatting position. And so it's better to just try to sit down fully on the toilet and relax in order to empty. If you don't empty your bladder all the way, you're going to have a greater likelihood of having some urge, shortly after you've used the bathroom. And, if there's a little bit of urine left in your bladder or your urethra, you may leak that, a few hours later or even within the next half hour. I don't know if anyone's heard of the knack technique. But that's a cute little thing that we call squeeze before you sneeze. Okay. So thinking about trying to do a little Kegel right before you partake in an activity that could predispose you to leaking. And it may not be sneezing, that may not be the activity that's troublesome to you, but you can apply that to other things too. Squeeze before you cough, squeeze before you jump, squeeze before you lift. And then finally, managing constipation and managing weight can also be really helpful in the prevention of urinary leakage. We're going to talk about constipation a little bit further on the next slide. But with regards to weight, even losing just 5 pounds of body weight can have a huge impact on urinary leakage. It reduces how much weight is being placed down through the pelvic floor, and the less body weight the pelvic floor has to support, it can do a better job at its other tasks like holding back urine. Okay, constipation and urinary incontinence. So why would these two situations be interrelated? Well, there's several possible reasons to explain how constipation can cause urinary leakage. Number one, having a history of straining during bowel movements can actually weaken the pelvic floor muscles. When you're pushing or bearing down or straining, it can stretch those muscles out and make them less likely to be able to hold back urine. Another reason for constipation causing urinary incontinence is an overfull bowel or an overfull rectum due to incomplete emptying can put pressure on the bladder, and that can then reduce bladder storage capacity and make you feel like you have to pass urine very urgently, which can then result in leakage. So what are some ways you can manage your constipation? Consuming a lot of dietary fiber can be really helpful. And there are many sources of dietary fiber, but some of the main ones are leafy greens, whole wheat products and whole grains, or ground flaxseed. And consuming a good amount of dietary fiber can make your stool the right consistency. So it's not too hard, it's not too small, it's not tightly packed. It's like a soft formed log, essentially, which makes it very, very easy to pass and fully empty. Also, back to that water intake, adequate water intake is very important for bowel health as well. If you're hydrated, your stools will be a little bit softer. Daily exercise can help keep things moving and encourage colonic motility. Toilet positioning, that's another strategy for managing constipation. You can see in the picture down at the bottom of the screen, unhealthy versus healthy toilet posture. And with use of the squatty potty, which is essentially just a little footstool, you can change the angle of the rectal canal, and changing that angle allows the stool to pass through very easily without any straining. So although the squatty potty or using a footstool will not increase how many bowel movements you have per day, it will allow you to pass bowel movements much more easily without any straining. And finally, avoid straining or breath holding when you're passing stool. Because as you remember, from a couple slides previously, straining or holding your breath can really increase intra-abdominal pressure. You don't want to do that. An increase in intra-abdominal pressure will lead to stress incontinence. Okay, so after all these strategies, you still feel like you need additional help? Well, that's where I come into play, as well as my team of other pelvic floor therapists at UNC. It might be helpful for you to talk to your doctor or just schedule an appointment with a pelvic floor therapist if you feel like you need additional help. A pelvic floor PT specializes in the reconditioning of pelvic floor muscles. Usually on the first visit, we try to do some sort of internal exam. Now, if it's something that you're not completely comfortable with, we can always push that off till a later date. But at some point, it would be really, really helpful to do a vaginal or rectal exam to indicate the true state of the pelvic floor. And then treatment can include a variety of things based off what we find from the internal exam. We may release tight pelvic floor muscles. We may strengthen weak pelvic floor muscles. We can also use biofeedback, which involves inserting a vaginal or rectal sensor. And based off of what you do with your muscles, we can see that muscle function on the computer screen. We can also use electrical stimulation to strengthen the muscles. we can take a look at your back, your hip, your core muscles, and focus on any deficits we find in those areas, and then provide a lot of education on bowel and bladder health and habits. So when is it appropriate to see a pelvic floor PT? There are a variety of conditions that we treat. These are probably the main ones, but there may be some that I'm missing. But essentially, if you have any of these conditions, then it would be appropriate to try to get in to see a pelvic floor PT. And they include, but are not limited to, the following: painful urination, strong urgency to urinate, or an inability to empty your bladder, urinary incontinence, fecal incontinence, painful bowel movements or constipation, pain during or after sex, pain with vaginal exams, prolapse symptoms, or just really any general chronic pain in the pelvic area. All right, and now I think we'll have some time for some Q&A.
Sarah, that was great. Thank you so much. There was a lot of really, really great information there. Certainly stuff that I didn't know, and I plan on passing along to my own patients. We see lots of orthopedic patients here who have things going on with low back pain or hip pain or whatnot, and there's many times where there is a pelvic floor component to it. So it's wonderful to have those resources right here for an internal referral. So it looks like we have a one question that's come through here, Sarah. Can you see the chat there?
I can, yes.
Okay, great. I'll let you address that directly.
Okay, so the question I see, guidance on Kegels, and then do I go ahead and go to my PCP or make the PT therapy appointment? Okay. So with regards to the Kegels, did you have some specific questions about how to do the exercise, or are you wondering if you should just go ahead and go to a PT first before you start those? And let's see here, how often, or if I know for sure if it's necessary. Well, usually I'll recommend that people do 10 repetitions of their Kegels and do that 3 times a day. But now that I'm seeing some more information coming through, if you've had many, many UTIs lately with urinary incontinence, it's possible that you could have some tension in your pelvic floor. As most of us know that have had UTIs, those are super painful, super uncomfortable. And oftentimes we're hesitant to go to the bathroom because it hurts so much. And so we might hold our urine. We may hold tension in our muscles to guard against the pain. So it's possible that even though you probably do have some weakness, you likely have tension in your pelvic floor as well. I would suggest probably trying to get in with a pelvic floor PT to confirm, what the situation is. And if you go to UNC Therapy Services, you do not need a referral from your PCP for all of our clinics. So you should be able to, through direct access, just make a physical therapy appointment. Hopefully that answered your question. Great. And then a next question I see is it better to work on Kegel exercises or concentrate on lower abdominal strengthening? That's a great question, Kristen. I think they're both equally important. Sometimes in the beginning, it's difficult to contract one area without activating the other because they do kind of work as a team. So I would say try to see if you can activate your pelvic floor. Try to see if you can activate your TA. If one seems easier than the other, then you may want to focus on the more difficult exercise first, but ultimately they're actually equally important. And when you get really good at doing the exercises, you should be able to activate your pelvic floor and your TA together and have them work in unison. Okay, Layla just sent a question. Any recommendations on pelvic floor exercise during third trimester of pregnancy other than Kegels and working on our TA muscles? Layla, do you have any pain? No. Okay, good. If you did have any pelvic pain, I would probably recommend staying away from a lot of Kegels. But if you're pain free, then I think it's okay to keep doing those. Um, I would say, other than Kegels and working on your TA muscles, you may want to consider doing some hip strengthening. A lot of times, the hips are extremely weak during pregnancy, and there's a lack of stability throughout the pelvis with all those hormonal shifts. So, our hip stabilizer muscles can be really lacking. So some good exercises you can do are bridges, working on some clamshells where you lie on your side and lift your top leg from your bottom one. You can do some sidestepping with a resistance band around your knees or your ankles, but that would be another part of the body to target other than just the pelvic floor and just the deep core TA. Do planks work the TA muscles? Is the next question I see. Um, Planks can work the TA, but you have to be really mindful of if you're activating those muscles during the exercise. So it can be easy to do a plank incorrectly where your abdomen just sags and you feel a little bit of bowing in the small of your back. So as long as you're really focusing on pulling your lower tummy in and keeping those muscles part of the exercise, then yes, planks can entirely work the TA.
Sarah, I think we have time for maybe one more question before we need to wrap things up here.
Sounds good. Thanks for including my email there too.
Of course. Going once. Going twice. All right. Well, then I'm going to go ahead and jump in on my MC duties here. Sarah, thank you so much for delivering this talk today. It was really informative and very well attended. So thank you everybody for coming out and signing on to this. In the chat there, I did put Sarah's email if you have specific questions for her. Also, earlier in the chat, I did put in our link to our Facebook page where you can find other events coming up and other talks we have for Therapy Thursday. So I encourage you to please go ahead and like our Facebook page. And then also our YouTube channel where we have other of our previous talks and technology willing, I'll have this one posted up there today or tomorrow. So I think that's about what we have for today. So thank you all. Have a wonderful rest of your Therapy Thursday and a very happy Thanksgiving. And we'll see you next time on Therapy Thursday. It'll be the December the 3rd. And I believe the topic is going to be about youth sports. Specific topic is still to be determined, but Catherine Duncan will be back joining us for that one. So it'll be very, very informative. All right. Thank you all and have a great day.
Thanks. Bye, everyone.